So we have question number 6 from GS Paper 2. Question number 6 says, public charitable trusts have the potential to make India's development more inclusive as they relate to certain vital public issues. Comment. So this question is related to the topic called NGOs in your GS Paper 2. There is a topic called development process and development industry, role of NGOs, SHGs and charitable trust. So the question is directly asked from there that what charitable trust can do to make India's development more inclusive. So it is a quite simple question. So public charitable trust are nothing but NGOs registered as trust. And if NGO is registered as trust, the goal of the public charitable trust will be not to make profit. The goal of the public charitable trust will be non-profit, will be for the welfare of vulnerable sections of society. Welfare. So in the introduction you can write what are public charitable trust. They are NGOs registered as trust but for non-profit. Then NGOs are partners of the state in development process. How they partner the state in development process? They fill the gaps left by the state. So the role of state, is quite clear. So if I just explain you that in the development process, there are three actors. One is state, the other is market, and the other is the third sector. So market takes care of rich after 1991. And after 1991, the state has been given the responsibility to take care of the vulnerable sections of society. Now, to take care of vulnerable sections of society, the state is running multiple welfare schemes. To run these welfare schemes, the state needs resources. But in a country like India, state doesn't have enough resources. So state is running welfare schemes, but through these welfare schemes, the state is not able to reach everyone. So to fill the gap left by the state. So what I told, it is duty of the state to reach vulnerable section, but state is not able to reach every vulnerable section because the state doesn't have resources. Now to fill the gaps comes the third sector. The third sector includes our NGOs. So NGOs which are registered as trust for non-profit are called public charitable trust. So I hope it is clear that what is public charitable trust. So same thing you can write here. What are public charitable trusts? They are NGOs registered as trust but for non-profit. The goal is welfare of others is the goal. So they partner the state in development process. How they partner the state? They fill the gap left by the state. What are the gaps left by the state? Areas where state is not able to reach. So state is not able to reach all vulnerable sections. For example, state is running a scheme called Ujjwala Yojana, where the state is distributing cylinders. But the problem is the state doesn't have enough resources to reach every woman who needs cylinders. So state is leaving some gaps. So if the target is to reach 100 women, the state is only able to reach 70 women. So to reach those 30 women, we have the role of public charitable trust or NGOs. So fill the gaps where the state is not able to reach all vulnerable sections. And why the state is not able to reach all vulnerable sections? The state lacks resources. Then you can give example of some public charitable trust also. Like you can write about Bill Melinda Gates, Ford Foundation, Tata Charitable Trust. Now you can see that there is one Tata Trust and one Tata Charitable Trust. Tata Trust is for profit. Tata Charitable Trust is non-profit. Non-profit NGOs, the goal is welfare of the others. So you can write about public charitable trust in your introduction. Then the question says what role they can play in the development, how they can make the development process more inclusive. So they can play an important role in the health sector for providing access to healthcare, especially in tribal areas, Naxal affected areas. They can provide access to healthcare. Then they can run many vaccination drives also, like Bill and Melinda Gates Foundation is running multiple vaccination drives. Then in the education also, they can provide access to education to remote areas, and that can be done through digital means. Then they can also help people in their skill development. They can run their own skill development centers. Especially they can run these skill development centers in rural areas. So the section of population which is not covered by the state, which is not able to avail health, education and skill development facilities, those sections can be catered easily by public charitable trust. So this is about sectoral development. Then many public charitable trust also conduct lot of research and survey. Their main task is doing research and survey. So research and survey, through research and survey, they come to know about what are the ground realities, whether the government welfare schemes are effective or not. After doing the survey, they prepare a report, and report act as feedback for the state to improve policies. For example, there is an NGO called Pratham. Now what Pratham does is, Pratham conducts a survey of children who are studying in government schools. They study whether the learning outcomes of the children are effective or not. Learning outcome means children are going to school, whether they are learning anything in school or not. So what Pratham found was that children in the age group of 6 to 14 years, where India gives free education from class 1st to class 8th, children are going to school, their enrollment rates are very good, but their learning outcomes are very poor. So that Pratham came to know that learning outcomes are poor by conducting research and survey. So PCTs can also tell the government whether your scheme is effective or not. Effective means whether the scheme is bringing any positive social change or not. So the report, the research and the survey done by PCTs act as feedback for the state to improve policies. For example, because of Pratham NGO highlighting the problem that learning outcomes in the children are poor, the government revised national education policy by focusing on improving learning outcomes. Then they also fight for the rights of others. Advocacy means fighting for the rights of others, especially the vulnerable sections, weakest of the weak, by filing PILs in the court. For example, many public charitable trusts talk about the rights of minorities. Then many PCTs also talk about transgender rights. They also talk about rights of prisoners. So through these methods, through these points, you can write 1, 2, 3. 3 points are enough. Through these points, we can say that in the conclusion, we can say that PCTs can act as very important partners of the state in development process. Quite simple question. You have to keep it short only because it is only for 150 words. The next question is question number 7 that was asked. The question number 7 says, poverty and malnourishment create a vicious cycle adversely affecting human capital formation. What steps can be taken to break the cycle? So the question is again very simple. It talks about poverty and malnourishment. There is a topic in GS Paper II specifically which writes poverty and malnourishment. So in the introduction, you can define what is poverty, what is malnourishment. You can define these terms. Poverty is lack of resources. Malnourishment is, nutrient deficiency in the body. It is not only about consumption of calories, but it is also about nutrient deficiencies, micronutrient deficiencies in the body. Now the question says, first you have to write how poverty and malnourishment create a vicious cycle. So after writing about poverty and malnourishment, you can just write this, you can explain this vicious cycle, how this vicious cycle is created. So poverty, people don't have resources. No resources means they cannot provide nutritious food to the children. If children will not get nutritious food, they will not have cognitive skills and they will always suffer from health issues. If they will suffer from health issues, again, their expenses on healthcare will also increase, shifting the household into poverty again. and if they will not develop cognitive skills, they will always do unskilled work. If they will do unskilled work, because nutrients are required for the development of the brain. If the brain will not develop, poor cognitive skills will result in making them unskilled. If they will remain unskilled, they will always do informal, low paying work. And if they will do low paying work, they will always suffer from poverty. So you have to explain this vicious cycle, how poverty leads to malnourishment and malnourishment leads to poverty. So this can be explained in the body also, or you can write this in the introduction. Then you can say that how does poverty, malnourishment compromise on human development? So you can say that India, because India is suffering from poverty and malnourishment, it compromises on health development indicators like India lacks skilled workforce. Because of lacking skilled workforce, India will have poor economic growth, and poor nutrition will again result in health issues, which will lead to poor life expectancy of the people. So India, because of poverty and malnourishment, is having poor human development indicators. So this is first part of the question. Then comes the body. In body you can write, the question says what measures the state, what can be done to break this vicious cycle. So you will say that state has to play a very important role in breaking this vicious cycle. So state needs to intervene. How state will intervene? Provide nutrition to the children. The state is already doing so through Poshan Abhiyan. You can write Poshan Abhiyan. One Poshan Abhiyan is providing midday meal to children who are going from class 1st till class 8th. The second nutrition is providing nutrition in Anganwadi centers. So you can write about these schemes in the answer. Then increasing vaccination coverage. Vaccination coverage improve hone se the absorption of the food, that the absorption of the nutrients will increase. So malnourishment will reduce. Then skill development will also reduce poverty. Skill development schemes of the government will also reduce poverty, especially in rural areas. Then you can mention about Gramin Kaushal Vikas Yojana and Skill India mission of the government. Then the government also needs to improve access to healthcare facilities, especially access to primary healthcare. This should be improved. Then, a very important point here will be about this scheme of NRLM. Under NRLM, women are mobilized into SHGs. If women are mobilized into SHGs, the income of the household will increase. See, in a household, there is a male member and there is a female member. Male member is already doing agriculture related work. Woman is free at home, so she can be mobilized into SHGs. And through SHGs, she can start her own micro enterprise. When she will start her own micro enterprise, this will create additional income for the household. So income will increase, income will get doubled. Male is already earning, female will also earn by starting her own micro enterprise. When the income of the household will increase, automatically, this will improve the nutrition of the children. Then improving sanitation facilities in rural areas. Government has done very good work in improving sanitation facilities in rural areas. There is, most of the villages in India now zero defecation, ODF, open defecation free. Then providing food rations. Government is already providing food rations under National Food Security Act. Now with the food ration, the government can also provide micronutrient food like millets, jowar, bajra, ragi. All these things can be pulses. All these things can be given along with the ration, wheat and rice. So all these things, this holistic coverage will improve the nutrition level. So we can also write it like this. In the body, you can also say that how to target poverty, how to reduce poverty, and how to target nutrition. You can divide your answer into these two parts also. How can state do so? So to reduce poverty, mobilize women into SHGs, diversify income opportunities of people, and go for skill development. You can write like this. Then in the nutrition, you can write that the government is already running Poshan Abhiyan. Then improve the quality of food given in Anganwadis and midday meal, make it more nutritious. You can also suggest distributing eggs in midday meal to children. Improving vaccination coverage. You can write like this also. Divide it into two parts: how to reduce poverty and how to reduce malnourishment. And then you can conclude by saying that if poverty will reduce, there will be direct impact on reducing nutrition. You can state like this. So that is your question number 6. Then the next question is question number 17. Question number 17 says it is about healthcare sector in India. So what is the question? It is a 15 marker question. See, in the crucial domain like public healthcare system, the Indian state should play a vital role to contain the adverse impact of marketization of the system. So the question says that over the period of time, because of the private sector, the private sector has entered the healthcare system also, especially the tertiary healthcare. Private sector has become very dominant. Now, suggest some measures through which the state can enhance the reach of public healthcare at the ground level. Now, the problem with healthcare sector in India is that the state budgetary allocation of the healthcare is very low. Since the state budgetary allocation of the healthcare is very low, the problem is that the state doesn't have enough resources to spend on tertiary healthcare. Tertiary healthcare by nature is very expensive. It is quite expensive. Machines are very expensive. Doctors are specialized. Their fees is quite high. Surgeries are very expensive. So because the tertiary healthcare is very expensive, that space in the healthcare has been taken by the private sector. So the question says that the role of private sector in the healthcare has increased. So what should the state do to contain the adverse impact of privatization, of marketization in the healthcare? And then you have to suggest some measures through which state can reach the public healthcare. So introduction, you can write what is marketization of healthcare and what are its adverse impact. So what is marketization of healthcare? You can write that there is increased privatization of healthcare, but without government regulating this, and this is mainly happening in tertiary sector. Then you can say marketization mein the goal of the private sector is only for profit. They seek profit. They have done commercialization of healthcare, which results in exploitation of the poor. So this is what is marketization of healthcare. Then you can write what is the adverse impact of this. The adverse impact of marketization, you can write in the introduction only. First, you can write what is marketization of healthcare. Then you can explain what are the adverse impact of marketization. Adverse impact is the poor people will not have access to healthcare facilities. In case the poor people had to access the healthcare, this will result in increasing their out-of-pocket expenditure, which will push them into poverty again. Then the third adverse impact will be India mein majority of the population is poor. See, rich are very few who can afford private healthcare, but the majority of the section is poor and lower class who cannot afford private healthcare. And since they cannot afford private healthcare, they look towards state. So what can state do? What can state do to reduce the adverse impact of marketization? First of all, state should increase its budgetary allocation for healthcare. At present, only 2% of the GDP is spent on healthcare. Your National Health Policy 2017 says that it should reach at least 5% of GDP. Now, why there should be increase in budgetary allocation in the healthcare? Because the problem with India is the population which is dependent on the state is huge. And since the population dependent on the state is huge, the state needs to increase its budgetary allocation. Then out of the budgetary allocation, the state needs to improve access to secondary and tertiary healthcare, which is the most expensive. Now, majority of the state budgets are used in primary healthcare. So we are saying that out of the budgetary allocation of healthcare, the state should increase its expenses on secondary and tertiary healthcare also. Now we can also say that if the budget of the tertiary healthcare will increase, it will the government can increase more tertiary healthcare hospital where private sector is dominant. So private sector can be private sector can coexist along with the government tertiary healthcare hospitals. For example, the government has given a target of opening around 16 AIIMS throughout the country. So they should increase this tertiary healthcare hospitals. Then to improve secondary healthcare, we can bring public-private partnership, which was suggested by Niti Aayog in 2017. Then government should also, the most important point is government should create regulatory bodies to control, to regulate the increasing marketization of healthcare. Now, this regulatory body will control prices in private hospital. This regulatory body will contain prices of not only the treatment but also of medicines, and will also ensure that quality healthcare is given as compared to what money is being spent in the private sector. So this regulatory body is the key to reduce the adverse impact of increasing marketization of healthcare, which can be played by the state. And we can also have a grievance redressal body. If there is some problem in providing healthcare by the private sector, people should have a dedicated grievance redressal. Just like the government has created a grievance redressal board, just like the government has grievance redressal bodies in the form of RBI for the bank, SEBI for the capital market, there should be one grievance redressal body especially for the private healthcare sector also. So this can be the role of the state in controlling the adverse impact. Now the next part of the question says, how to increase the access of healthcare facilities to grassroots level. Again, the state will do it. How state can do it? In case of primary healthcare, the government is doing a good job in opening health and wellness centers. These health and wellness centers provide a very good comprehensive healthcare. Comprehensive healthcare means it is providing basic facilities for non-communicable disease as well as communicable disease. So they are providing very good healthcare. Moreover, comprehensive healthcare through health and wellness centers also includes integration of Ayush healthcare. It also includes preventive healthcare. Preventive healthcare means बीमारी हो ही ना आपको, उसके लिए the government is organizing yoga camps through health and wellness centers. So comprehensive healthcare at grassroots is given through health wellness centers. Then government can also strengthen the network of ASHA. They can also increase the role of ASHA, train her as nurse also. This can also be done. Then in secondary healthcare where we don't have resources, the government can rope in the private sector through public-private partnership model. This can be done. So what will happen in public-private partnership model? The district hospitals will be set up by the private player. They will run the hospital for a period of time and then recovering their profits and then transfer it back to the state. So we can bring build, operate, transfer model in district hospitals. This can be done. Then in tertiary healthcare, which is the most expensive healthcare, which mainly affects the poor, the government is increasing the coverage of insurance through Ayushman Bharat initiatives. This we have already done. Recently, the government has made it for all who are above 70 years. So Ayushman Bharat can play a very important role in improving insurance coverage. The cost of the insurance can cover the medical expenses. Then, the government should spend more on tertiary healthcare. As I told that the budgetary allocation, the 2% of the healthcare budget is mostly spent on primary healthcare. So government should increase its budget and spend more on tertiary healthcare. When it will spend more, it will open more hospitals. government hospitals in tertiary healthcare. And this is very important also because you can write that National Education Policy 2020 has clearly said that India will very soon face a growing burden of non-communicable disease. Now, non-communicable disease are to be treated in tertiary healthcare. If the burden of non-communicable disease will increase, poor people will suffer. They will have to spend more out of their pocket. So that space needs to be filled by the state by spending more on tertiary healthcare, by opening more tertiary healthcare hospitals. So all these methods can improve access of healthcare at grassroots level, and these measures have to be taken by state. So you can write answer very clearly like this. So in the introduction you can write what is marketization and its adverse impact. In the body you can write what state can do to control the adverse effect of marketization. And third, you can write how state can improve access to grassroots levels. Then you can write these points. So that will be your 15 marker. Thank you.